of our end of conference related to the Triple R call. And thank you very much for taking the time to join us. And I just want to say thank you to all participants for yesterday. And I think we had a very insightful, interesting, and stimulating discussions in relation to the project's outcomes. And we were also very much pleased about the way how we led the discussion in the breakout groups. And I can reassure you that, particularly in relation to the key points you raised, how the transatlantic platform should more facilitate the building of the transatlantic partnerships, that will be, we will definitely make sure that the key points raised will be discussed among the funders and find ways how we can incorporate them into the future activities. For colleagues and participants who are joining us for the first time today, let me introduce myself. My name is Manija Kamal, based at the Economic and Social Research Council. I am part of the TAP coordination team, and the coordination team organized this end of project conference, and I'm delighted to be joined by my very helpful colleague, Holly Routley-Grave, based also at ESRC, my colleague, Dr. Kavita Hamza, based at the Sao Paulo Research Foundation, and I believe my other colleague, Julia Warnes from the Social Sciences and Humanities Research Council Canada, might be on the call today. So with regard to today's plan, we are following a similar approach what we did yesterday. So that means our focus will be to discuss the key findings of your projects in the roundtable. The two roundtables are moderated by Christopher Barrie and Sarah Ganter, who's based at Simon Fraser University in Canada, and Christopher Barrie is based at Oxford and New York University. And so we will follow a similar approach. So that means lead PIs are invited to give a presentation of only 5 minutes about the key findings, and after that we invite all team members and PIs to share their thoughts and contribute. And after that, after 60 minutes, we will open the plenary session for questions and answers. With regard to the interactive element of today, it will be focused on your experience, on your insight. So the aim is to find out, based on your experience being part of the Triple R call, how we can improve our processes for the future calls. And in order to do that, we included an interactive survey via Mentimeter. We do that, and then based on the results, we then divide you in breakout groups in order to give you all the space to share some additional thoughts, and then we will come back in form of a plenary feedback and capture the results. So that's the plan for today. I hope you had a chance to look at the agenda and also to familiarize yourself with the material in relation to the key findings. And I think I'm very much excited to see how it goes. And I'm just checking. Holly, are there any additional points you would like to add?
No, I think you've covered everything. Just to say, I'm looking forward to hearing from the projects today as well.
Great. Okay then. Can I just check? Is our moderator now available? Christopher?
Yep,
Christopher Barrie? Great, Christopher. Thanks for joining us. So I'm delighted to introduce Christopher Barrie. He is an assistant professor for sociology at New York University and part-time research fellow at the University of Oxford. Christopher is a political sociologist with an interest in conflict, identity, and communication, and he is also active in the development of new computational methods for the social sciences. He is the lead PI of the project A Cross-National Study to Promote Democratic Dialogue on Social Media using Generative Artificial Intelligence, which was funded under the TAB Democracy Governance and Trust call in 2024. Christopher, I'm just handing over to you. Thank you.
Thanks very much, Mihelj. Thank you for the chance to serve as discussant on here. I'm hearing some audio from other participants, so if you're not speaking, could you please turn off your microphone before we get going? I'm not going to say too much. Mihelj has introduced me, and this is not about me. So let me introduce the first of our PIs. I think we'll go in the order of the schedule as I have it in front of me. So we have up first our PI Mihai Varga. I will be fairly strict with time, so I'll show you on camera or I'll interrupt with 4 minutes. And then after 5 minutes, I will be interrupting you because we are relatively tight on time. Mihai, over to you if you want to share your screen.
Yes, thanks, Christopher. Can I get a bit of help from Manaja or from Holly here, please? Because I cannot share my screen. Maybe you can show my presentation. Yes, so just you can go directly to the second slide with the map.
Would you like me to do that, Mihelj, or are you?
Yeah, Holly, if you don't mind.
Yeah, that's fine. I'll get that up for you now, Mihai.
Okay, thanks. Yeah, so my name is Mihai Varga. I'm the lead PI of ENDURE, so the acronym of our project. We are a consortium of 9 universities, so universities in 9 countries on both sides of the Atlantic, 4 in the Americas, and 5 in Europe. Maybe you can see our slide. So our presentation slide with a map, not yet, right? Oh, here it is. Exactly, yes. So we also had research carried out in a few more countries, so Ukraine, Romania, and Turkey, plus for some of our components, also South Korea and South Africa. And let me also share like a few warm thoughts with you about the support we received from TAB and also my appreciation for this program because it made possible this kind of work and cooperation on both sides of the Atlantic. And having said that, I will simply discuss a bit, present a bit our findings across 5 clusters. Holly, you can end the presentation. Yeah, so I think people have it, but it's too much text. I will just summarize. So we had a first cluster in which we're asking about governance. So the governance during the pandemic, and we had a couple of pessimistic insights, I guess. So about something that we called the authority paradox, that many governments we studied at the same time decentralized the accountability for their decisions, while on the other hand, contestation was severely limited. And this was a somewhat of a self-defeating strategy because people, especially in communities on the ground, had different expectations. They had an expectation from their past interactions with governments that they will be consulted. So this was one problematic aspect. The other one we came across was that many authorities ignored minorities and migrants, while on the same time, you also had a discourse in the media that problematized minorities and migrants as basically unwilling to support certain measures or to distant from information sources. Again, that was problematic because there had been a pattern in these countries, for instance, in Germany, the country where I am based, of including migrant organizations in decision making, and this was absent. So this was one cluster, cluster one. The second cluster was about consisted of field work. Yes, so we did field work among essential workers from Brazil and Colombia to Turkey, Poland, Ukraine, and Romania. So essential workers, of course, I mean workers in essential sectors, because that's one of the problems that we came across. I think it's a point already known also from other studies that being in an essential sector, a sector characterized by governments as essential, doesn't mean necessarily that you also enjoy more beneficial or better working conditions. Actually, it turned out to be quite different for the workers we studied in healthcare, in education, so particularly teaching, social work, and so on. Actually, we found these essential workers to be at particular risk because of the conflicting expectations they were under. So on one hand, the resilience, the story about resilience we came across is that workers, as we heard also in our discussions yesterday, workers were very much motivated by their own ethos, professional ethos towards beneficiaries or clients, but on the other hand, they also felt duty or concern for their families while having to work. Yes, while being actually forced to work. So our story about resilience is one that made us think about the resources that resilience needs and that can be depleted in particular. So a temporal, let's say, dimension to resilience that we don't hear often about, and that was crucial for the workers we studied. We also had a cluster in which we looked at public communication during COVID, so for which we created a database of 6 million tweets back in the days when it was possible to use that data freely and not with the costs associated today. I think
1 minute remaining.
One of the critical insights we had was that public health communication became too early enmeshed with political signaling of loyalty towards one or other of the camps. And we also had a team delivered across 5 countries, including Brazil, US, Germany, UK, which also showed the strength of partisanship that Trump's positioning, yes, so also regarding vaccination, yes, so that was also more or less a political choice, but that left also an effect on the populations we studied, namely one that, I mean, the more distrustful you were of the vaccination, the more likely you were to be disillusioned about the democratic political system in your country. And that's it. So we had this clusters. I think you can read more in the bit more in the presentation you've all received.
Thanks a lot, Mihai. That was great, and thank you for keeping to time. We're going to run through, I think, all of the presentations, and then we're going to have a chance for an open discussion session. So, Thomas, you're next up.
Excellent. Bryer. Thank you so much. Thank you, Holly. If you don't mind sharing my presentation on screen as well, and I'll begin while you're pulling that up. I appreciate it. I'm the lead principal investigator. Oh, thank you. I'm the lead principal investigator for a team that includes colleagues from Canada, Poland, United Kingdom, and United States. The title of our project is Exploring the Role of Adaptive Capacity on Democratic Performance, Government and Nonprofit Organizations During the Pandemic. We have branded ourselves as a team as Adaptive Democracy, and you can visit our project online at adaptivedemocracy.net. Our team is multidisciplinary and multi-methodological. and our project reflects the values, interests, and strengths of all team members. I'm sharing today some of the findings from a nationwide citizen survey conducted in each country over 2 waves, with an aggregate average response of about 2,350 in each country. The survey is itself adapted from an instrument developed and tested by the Political Communities Surveys Project, led by our colleagues in Canada. I'm also sharing some practical recommendations that we have shared with community stakeholders in 4 focal metropolitan areas in each country. These are Montreal, Canada, Warsaw, Poland, Manchester, United Kingdom, and Atlanta, United States. These recommendations are based on interviews we conducted with government and nonprofit officials across countries, suggesting steps that can be taken today to enhance adaptive capacity for more effective and democratic response to future pandemics and crises. But first, and looking at this first slide, I'd like to share a couple of headline findings from our survey. While noting that the survey had more than 600 items, and we're very busy mining the data and running models for multiple article and book projects that are still underway. So I'm just sharing a slice, a very small slice of all the data we've collected. As seen in this figure, 1 in 3 citizens across countries, 35%, felt that their governments efficiently and effectively executed their adaptive governance capacities when it came to tasks such as procurement and dissemination, the implementation of required regulations and supports, the implementation of lessons learned and controlling the spread of the virus, reacting to global developments and scientific insights, and reacting to various public demands and consequences. The even more concerning pattern shown in these data is that the average citizen in these countries would likely view such effectiveness and efficiency evaluations as falling well below their own personal standard of acceptability, a 20% or 20-point gap. In the US and the UK, the average gap between citizens' perceived adaptive governance capabilities and acceptability standards are an average of 7% larger than in Poland or Canada. Another insightful point, as seen in the next figure, if you go to the next slide, is that both positive and negative experiences, i.e. receiving COVID-related services and or benefits, or on the negative side, getting sick with COVID, being hospitalized and or losing a loved one to the virus, helps to improve or boost citizens' evaluations of government's policy handling and their adaptive governance capacities. The reason we see this, we believe, is partly intertwined with the increased direct exposure to the pandemic, its consequences, and the challenges and stressors that experiences likely entail. These experiences might help citizens to better appreciate the magnitude of the economic and or health-related consequences and to become more attuned to these vulnerabilities, in turn making them more empathetic to their political authorities and governments as a result. It is not simply, however, whether experiences are positive or negative that matters, but likely what citizens make of their respective paths through the pandemic and how supported they felt by governments and or nonprofit organizations. And this leads us to our recommendations to organizational leaders, and you can go to the next slide, again, based on interviews to ensure responsive and democratic performance in the future. These are only a few of the recommendations that we are still finalizing. The final set are being co-constructed with participants and partners in the research from across countries. We identify recommendations for intra-organization adoption and inter-organization adoption. They are noted with suggested financial costs and effort costs to implement them, as well as the adaptive capacity components and subcomponents that they address. In this case, culture, structure, leadership, and resources, thank you, as the main components. We also identify possible trade-offs should these recommendations be adopted. In other words, what do organizations or groups of organizations need to sacrifice or otherwise address through harm mitigation in order to boost capacity. You can go to the next slide just for everyone to see what's on the inter-organization side. I'm not going to walk through each of these recommendations now, but you can contact me or any member of our team if you'd like to discuss or learn more about them, how we developed them, and how we are advancing them to maximize impact across communities and countries. And with that, I'll turn it back. Thank you so much.
Thanks a lot, Thomas, and I hope we're going to have a chance to have a discussion about some of these recommendations and how they might sort of speak to each other as they emerge from each project. Adriana Piscitelli is next up on the schedule I have.
Sorry, and Adriana, I believe you're muted. Sorry, we can't hear you. I believe you're muted, Adriana.
Sometimes the host of the meeting has the permission to unmute a participant. Is that something you could do, Manija?
Yeah, I tried, but it didn't work. So Holly, I don't know whether you have got some more rights.
No, it's grayed out for me, for Adriana.
Yeah, for me as well. Yeah, for me as well. So Adriana, I believe you need to do that, please. Otherwise, we can't hear you.
Adriana?
It's on the top right.
Okay.
It's on the top right near this red button. Yes, maybe it's this way.
Yeah, I think she mentioned that she would log off and in again.
Oh, okay.
Okay, so let's move on to the next on the schedule, and then we can circle back to Adriana once that's been resolved. So Sabina, if you have your materials ready, we could move straight to you.
Yeah, I can go next. Let me just share my slides. Hopefully that will work. And switch to presenter mode. All right, I hope you can all see the slides.
Yes, we can.
Yes,
yeah,
we can.
Okay. Hello, everyone, and thanks for organizing this event. I found it very useful already yesterday. So my name is Sabina Mihelj. I'm a professor of media and cultural analysis at Loughborough University, and I was PI of the so-called Punkabop project, which examined pandemic communication in the context of populism, and the project ended last year. So you might wonder why we chose to focus on this particular topic, so the link between pandemic communication and populism. And I've selected this quote here from one of the many interviews we conducted with professionals involved in crisis communication during the pandemic in 4 countries that we focused on, and those were US, Brazil, Serbia, and Poland. So here is a communication official in the Department of Health and Human Services, which is being reduced at the moment quite drastically in the US. Talking about how they've done a lot of exercises and preparation for a crisis of this type, the various scenarios they played out with colleagues to be prepared for this eventuality. But there was one thing they weren't prepared for, and that was the potential that the White House, the president, the vice president of the country would completely disagree or say things contradictory to what the scientific experts within the government were saying. Now, this quote is indicative of something that became a new problem or a relatively unknown problem in the context of a pandemic. And that was the problem that we believed in the team was created by a particular types of politics and political communication that was characteristic of populism. Now, this kind of behavior is represented here in this quote, however, did attract a lot of attention at the time in the media, not just in the US, but also Brazil was very much in the media at the time. But what we realized quite quickly on in the team was that this was not, this was obviously not fully representative behavior of all populist politicians who were leading different responses to the pandemic globally at the time. So in the project, we tried to select countries that that all shared populist leaders at the time, and specifically right-wing populist leaders, but that ranged quite significantly in the way they approached the pandemic. So on the one hand, countries such as US and Brazil that didn't take the threat of the virus seriously, and on the other hand, Serbia and Poland that actually did adopt a very different approach, and also had a different kind of relationship between the experts and the political elite to then try and develop a more dispassionate comparative analysis of the impact that populism can have on crisis communication in an event of this kind. So we focused on 4 countries, as I said, and we identified 4 key elements of what we call the pandemic communication cycle, or the health crisis communication cycle. We started with the government-led health crisis communication, then looked at media policy, at media coverage, at the link between public attitudes and news habits, as well as the encounters with misinformation, and finally at the role of pandemic geopolitics, with a particular focus on Chinese and Russian vaccine diplomacy. And we did this through a range of methods, including elite interviews in 4 countries, policy analysis, media content analysis, population surveys, as well as various secondary sources. This is most of the team that I led at the time. There were 5 co-Is working with me in 4 different countries, as well as, to begin with, 6 different research associates. We then had to employ another 2 to cover for illnesses and things like that, to be able to finish the project in a relatively timely manner. We also cooperated with different partners from the media and communication sector, regulatory authorities. This is a list of partners that I'm showing here that we started with, but we then engaged a various range of additional stakeholders, including WHO, national regulatory authorities, NGOs, and so on. I'll quickly talk through some of the findings, and please feel free to stop me, Chris, whenever I'm approaching my limit. So looking at government-led crisis communication, we had quite a bit of conceptual ground to cover first, to identify the key elements of populism that were likely to affect crisis communication, and then look at the extent to which these elements did really have this impact. So we did find several of the elements we identified present across all 4 countries, but with politicization and polarization particularly prominent. And we also identified 2 distinct patterns of populist crisis communication that were linked to different types of responses that these populist leaders had to the pandemic to start with. This was already published in an article and has had some good responses already. Looking at strand 2, media policy, again, we developed what we believe is the first conceptual approach to populist media policy. And we concluded on the whole that these media policies oscillated between control and support. So on the one hand, they were designed to expand government control over communication, but in ways that went beyond what you would normally expect in a crisis of this kind, and extended to limiting journalist access to public information. And on the other hand, some efforts also to support media that were affected by restrictions during the pandemic. Now, on the whole, the drive to control in all 4 countries overshadows the efforts to support the media. And when support was being provided, it was often distributed in an untransparent and biased manner that actually benefited pro-government outlets, and that was true of all 4 countries. Another thing we noted was that there was very little effort to develop policies or measurements that would be designed to combat health misinformation, and that was again true for all 4 countries. This piece of research has just been accepted a few days ago and should be published fairly soon as well. Looking at strand 3, this was an analysis of media coverage in all 4 countries, where we, again, in line with the nature of government communication, we also found that the media coverage of the pandemic was very politicized and polarized. And the effect was that actually we could argue that such polarization prevented a dispassionate debate about the actual pros and cons of the government measures that were being implemented, because the media, rather than providing an open space for discussion, often took one side or the other. And again, this was true in all 4 countries. And we looked also at the extent to which this was affected by ownership pressures and regulatory control and different types of media systems that we have in these 4 countries.
Sabina, I think I might jump in at this point and suggest that we we move some of this to the plenary discussion.
Absolutely.
I'm
yeah,
very
I'm happy
conscious
to
that you've
finish at
produced a
this
huge
point.
amount of research during the time of this grant. It's hard to cover in the context of 5
Thank
minutes.
you.
But,
Sorry, I didn't hear your initial warning.
No,
That's
no
why.
worries. I allowed
Otherwise,
you
I
to
would
go
have
over
tried
time
to
because
wrap up.
I was interested to hear.
I'm
Okay.
happy to stop sharing as well. There we
Sure.
go.
Okay. Thanks a lot, Sabina. Have we resolved some of the issues with Adriana, or should we go to the next speaker? Oh, yeah, we have. Fantastic. Okay, over to you, Adriana.
Yes, I apologize for that. Holly, would
No
you
worries.
kindly put my slides on and fix it in the third slide? Okay. Our project, the Gen Migro Research Project, explored the experiences of migrant women and their families during and after the COVID-19 pandemic, focusing on 4 countries, the United Kingdom, Poland, Germany, and Brazil. And we also analyzed data on Brazilian female migrants in Portugal. The research team comprised academics from the University of Strathclyde, UK, the University of Dortmund, Germany, the Jagiellonian University in Poland, and the State University of Campinas in Brazil. In each country, the researchers collected interview data from stakeholders and migrant women and their family members. Adopting a transnational, intersectional, and comparative approach, the project aimed to explore how the global nature of the pandemic impacted patterns of female mobility in the context of different national responses to the crisis. The analytical focus was on the vulnerabilities and also the agency and resources that women mobilized to navigate the crisis. In each country, we analyzed the increasing inequalities in the working conditions of migrant women, their access to social protection, and the effects of the pandemic on family networks, care practices, and community support. And we paid attention to how violence crisscrosses these aspects. Our main key findings are, first, the COVID pandemic has exacerbated existing inequalities for migrant women. Government measures to contain the pandemic have strongly impacted economic sectors in which migrant women are overrepresented. Women were also particularly affected by the cumulative effects of service closures, the digitalization of administrative processes, increased care responsibilities, and mobility restrictions, including international ones. Second, they face barriers to essential services, healthcare, and support for domestic violence, as well as housing and education, and many were subjected to domestic violence. In Germany, the UK, and Poland, women reported mental health issues due to their stressful situation. 3, the pandemic has exacerbated the lengthy procedures for residence permits, asylum applications, and naturalization processes, increasing stress for many women. 4, travel restrictions undermined women's ability to draw on kinship and community networks. 5, grassroots community groups, NGOs, and faith-based organizations provided crucial support to mitigate the impacts of the pandemic and the lack of state support. These organizations offered legal advice and psychological support. In Brazil, several also provided much needed food and hygiene materials during the pandemic. In the grassroots organizations, migrants demonstrated the collective resistance through activism, formal and informal self-organization, and solidarity with other women. But we also realized that the pandemic period was sometimes perceived as less damaging than the post-pandemic period. In Brazil, for example, during the pandemic, some migrant women, lacking specific public policies, obtained significant benefits from the universalist policies implemented during this time, while the post-pandemic crisis was characterized by intensified poverty and violence. We have not yet been able to work in a comparative analysis as we wished, but we can observe that in some countries, the pandemic intersected with other crises, as in the case of Poland, with the war in Ukraine crisis. In Brazil and Poland, different groups of migrant women have an equal access to support and resources based on their country of origin. In Brazil, racism and xenophobia are issues that affect particularly the lives of women seen as Black, of African and Central American origin, as well as indigenous migrants and refugees. They suffer institutional racism within state bureaucracies, at work and shelters. And gendered violence against migrant women also involves intense labor exploitation and sexual violence. And now I'm concluding by saying that we also observe that countries on the peripheries, such as Poland and Brazil, have functioned as the externalized borders of the European Union and the United States. Poland built a fence along its border with Belarus to control irregular migration. Brazil has recently deported large numbers of migrants of certain nationalities from São Paulo airport in an explicit attempt to prevent them from entering Brazil and then traveling to the US. And these measures have had specific effects on migrant women. I'm showing this particular slide so as to give you our address of the project, where you can see all our briefings, and also a wonderful book, Women Who Migrate, which was an outcome of the project and is destined to non-academic audience and was produced collectively by our young researchers, the postgraduate researchers. Thank you so much.
Thanks very much, Adriana. Okay, now on to our final presentation from Anne-Emanuelle Birn, excuse me.
Holly, could you share my slides, please? And I'll have you walk through them if that's okay. So, bon dia, bonjour, guten Tag. I'm really delighted to be here with all of you. It is really just an honor to be presenting on behalf of the amazing research team, both the PIs and co-PIs, but especially our trainees, who I hope many of you have met over the last few days. So our project was really looking at community mobilization, advocacy, activism, and the extent to which it influenced policymaking in these different settings. And what's particularly interesting for us is that we chose not to have a top-down kind of overarching comparative approach, but rather incorporated a dialogic approach and a south-north approach from the very beginning. And so what I'm going to do is walk through each of the projects very quickly, if I could have the next slide, and then we will look at particular resonances, which we've already seen with the projects presented this morning, and some of the dialogues that we've developed and the ongoing research engagement across the projects. So in Brazil, our team produced a comic book, video, a variety of memoirs of women from the Jardim Colombo favela in Sao Paulo. And the idea was that this repository of resident narratives would then serve as a form of community memory of the resistance. And in large part, this is because of the very constrained, problematic response of government entities. So thinking about decentralized governance is also community governance. And you can see here some of the team members and projects. Next slide, please. In Canada, we had two projects, one in Ontario, the other in Quebec, in Montreal, both looking at made marginalized migrants. In the case of Ontario, we were looking at migrant agricultural workers from Central America, Mexico, and the Caribbean, who were essential workers and yet had extremely constrained living and working conditions. So very much failed by pandemic policies amid government inaction. And yet, given the level of activism, there were temporarily some imagined alternatives for policy changes, so such as the status of resident for those coming in. Media coverage ended up being extremely important in both cases to raise awareness of who was producing food serving as essential workers in Montreal as well. And infamously, the UN Special Rapporteur called the temporary foreign worker program in Canada a breeding ground for contemporary forms of slavery. In Quebec, there was enormous blame of the marginalized neighborhood residents. There was a comic book that was developed, and then a shared funding from a philanthropy that was both helpful and harmful in many ways. And in the discussion, we can talk about the tensions that were generated by these private actors. Next slide, please. So in the case of Germany, in Bochum and Gießen, again, working with migrants, found systematic neglect of lived realities, very little official communication in languages other than German. In the Bochum Community Lab, really some intense community research showing the high relevance of pre-existing social support structures, as well as in Gießen, engaging medical students in the community and showing the importance of the commitment to decision-making by social workers, teachers, and others. So again, resonating across the projects, the critical infrastructure provided by communities for care that needs to be sustained locally. Next slide, please. In Peru, in the Amazonas region and communities of Xuxung and Huachapea and Chiriaco, there were diverse responses, solidarity networks sustained through these trust relations, but also prior experiences, both negative and of course, in terms of state abandonment and the colonial oppression of indigenous peoples, but also the importance of local organizations involving youth, family networks, and so on, and some interesting parallels between the case of Amazonas and that of Montreal around vaccine resistance and hesitancy. And again, methodologically involving the community at every phase of the project. And to the last slide now.
1 minute to go.
Yeah. So our collective approach and KM really all enabled by this incredible trainee network. Again, I hope many of you have met the trainees in these days. The idea here is that these are young folks who were very much constrained themselves by pandemic limitations, didn't have the chance to engage in international conferences and so on. And so both virtually and 2 meetings in person so far, and hopefully another one, the first in Sao Paulo, then Toronto, hopefully in Germany next, we have been able to carry out our project dialogically, again, through Paulo Freire's ideas, and think about global health as an arena of engaged activist research, community academic learning, and South-North. So again, community organizations on the ground stepped in to address government failures. We've returned so much of this knowledge through media coverage, videos, articles in press, and so on, and town halls, comics, and so on. So for us, really, this experience of solidarity indicates community and especially community agency and the importance of shared values and principles and co-produced knowledge, or what we call DNA, or dialogical non-extractive approaches, leading to community-led social justice and health justice transformation. Thank you.
Thanks so much, and thank you to all of our participants and speakers today, serving as PI on all these grants. I learned a huge amount reading your slides and listening to you today. I've got a number of notes and a number of questions that came to my mind, but I'm also conscious that everyone in this room is far more expert than I can claim to be on these subjects. So I don't really want to prioritize my own comments, reflections, or questions. I really want to invite people who are on this call, members of the different grants, to give us their own contributions, and those contributions can be in the form of questions, but also invite sort of more broad reflections on kind of shared priorities and findings of these different grants. So I really give the floor to you if you want to just put your hand up, either in video or by raising your hand with the raise hand function on Teams. I will then hand the floor to you. If you need some more time to collect your thoughts, then that's also fine, and I can ask some questions myself. But does anybody have any initial thoughts or questions that they want to share? Yeah, Adriana, over to you.
Sorry, you are muted.
Oh, again.
Okay. But we can hear you now. That's good.
No, that's okay. Well, thank you all for these very interesting presentations. I would like to ask to the researchers who we worked with grassroots groups during the pandemics, when we can see in several parts of the world how solidarity was impressive and so important among the most marginalized people. If you also worked with them during the post-pandemic period, and if you did, what happened during the post-pandemic? I can then afterwards share my impressions.
Well, I think we lost Adriana there, but I think we got the sense of the question. Hopefully she will rejoin us shortly. But did anybody, we have her back. Did anybody want to respond to Adriana's point first before we return to her?
Maybe I can address for a moment, and hopefully Adriana returns shortly, because one question that I would have asked her, and I'll ask everybody, a point that she raised was that for many of the organizations with which we worked, the pandemic was only the initial crisis situation that led to some transformation and learning and adaptation. But then we had, of course, the migration challenges and crises related to Ukraine. We had in the United States Black Lives Matter and the social unrest that occurred in this period of time during the pandemic as well. So we have all of these crisis situations that emerged, and so it's really an interesting question to think what is post-pandemic and for these organizations, because many of them moved from crisis to crisis to crisis.
Yes.
And that has created just a need for an ongoing cycle of learning. But we also, from our observation across our countries, we saw a number of organizations fall back to their prior way of working, particularly when it comes to working together collaboratively across organizational lines and through partnership. Once the official pandemic ceased to be as prominent, despite these other social issues and policy challenges and political challenges, economic challenges. Many organizations did not seem to fully embrace the new mechanisms developed for collaboration that emerged during the pandemic. And that's something that we find to be a bit interesting, given that the crises didn't stop coming. They took different form, but would love other experiences as well.
Good.
I recognize we have two hands up. I don't know if they were directly in response to Adriana's question. I imagine Anne-Emanuelle's was, and Nadia, was yours a separate question?
Sorry, can I go on?
Sorry, was yours a response to Adriana's question?
No, not at all.
No,
it's a different question.
Okay, so we'll wait for you if that's okay, Nadia, because I think Anne-Emanuelle wanted to respond to Adriana. Is that correct?
Yes. So
yeah,
what
please.
Yes, and I'm also going to invite our trainees from Brazil and Peru to speak briefly on those contexts. Let me just start in the context of Ontario. There have been 30 years of very intense activism and solidarity work, organizational work in conjunction with migrant agricultural workers since this program started. And so, part of what our research assistants did was construct this historical record and timeline, a database of all of the activities folks were engaged in. And so this, the pandemic was an opportunity for more visibility, but what was going on and what continues to go on is not circumscribed to that time period, right? So I think what's very important is how the pre-existing, as I mentioned in my presentation, kind of communities of critical care came together. That infrastructure was present and able to react. And then the continued concerns, for example, around housing quality. There was just a meeting of advocates and organizers last week at which we had a town hall of continuing to struggle for improvement in housing. And there's a bunker situation, and some of the first COVID deaths were among Mexican agricultural workers in Ontario. So let me ask now for if Pamela and maybe Lucero can speak to ongoing activities.
Hi, Pamela speaking. Hi, everyone. Good morning, good afternoon. As Anne-Emanuelle said, in Brazil, in Paraisópolis, they already have a network built to deal with many precarious situations that are historical in Brazil. So in the post-pandemic, they still needing much more. The comic book that we did has many histories about the post-pandemic. They talk about what they passed in pandemic, but there are more. There are others who speak about now, what is happening now, like don't have jobs like they have before the pandemic, or conditions in the health access that is still difficult until now, and I think we kind of complement this self-organization, but it's due to a pre-existing, very precarious situation that made all of this exist. And during the pandemic, they were volunteers and received some donations, but it was for a short time. After pandemic, they still needing to deal with the old problem.
Lucero, could you also add something from Amazonas?
Yes. Good morning, good afternoon. In the same line that what Pamela said, in these indigenous communities, our home communities, they reactivate solidarity networks and family networks that already existed. And after the pandemic, those networks and strategies that were developed during this period of time were still active, but not as the same as in this period of time. Well, having in mind that this region has a lot of problems of access to healthcare system, but yeah, that in this period, these strategies and networks were they use these previous experiences, but after the pandemic, the intent of the use of these networks decreased, but they are in the, how can I explain this? These were already, they already have these networks in these communities. Thank you.
Thank you. Thank you, everyone, for providing these reflections. I'm conscious we haven't heard your own reflections, Adriana, and then we can go to Nadia, who had a separate question.
My own reflections. If Dorota is around, is Dorota here? Dorota and Julie?
I see a Dorota in the list of participants.
Dorota.
Yes.
Yes,
Why
she's here.
are you putting me on the spot?
Yes, yes. And I also would like Julie to talk about Brazil. Come on, what do you feel about the life of organizations in pandemic and post-pandemic time in Poland?
Yeah, first I wanted to actually respond to, I think, to Thomas about how we reframed our final report. We actually framed it not as gender, mobilities and migration during and post-pandemic, but actually during poly-crisis. Because that's what we observed in partner countries, that it's been one crisis after another, and pandemic was just one of them. And that's what came up in this in-depth narratives of women we spoke with in the 4 countries. To be honest, on the second part, I cannot comment that much. I think Christina should. Yeah, I think she would be a better person to comment on the second one.
If Christina does want to join in, or Julie, but what I would like to say about the Brazilian experience is that yes, the organizations already existed, and they also received a number of persons and help during the pandemic and had much more aid. But one amazing thing is that women migrants who joined during the pandemics discovered in this, and were not there before, discovered in these organizations the strength of collective action and did not leave afterwards. Okay, so that's something that is a positive aspect of the pandemics regarding collective organization. That was the only thing I wanted to say. In fact, we found a number of positive aspects during the pandemic. That's it.
Okay, Eva, did you have a response to?
Yes, I can speak a
you.
little bit from the Polish side in relation to the organization. So I think what was maybe the most kind of a spectacular case in our analysis was the social mobilization after the Russian invasion on Ukraine, and that was this massive crisis that has occurred in 2022, and that I think was from the point of view of social mobilization and organization, that was a very important moment, because that was really a moment where all the grassroots organization initiatives really stood up in this like common humanitarian support to the refugees that were coming to Poland from Ukraine, and that was this first moment of a very big social mobilization. It was also very important to see how these organizations later moved within this crisis, because at start it was very grassroots, then there was a lot of funding coming also from international organizations, and then there was this kind of an abundance of the field by the international organizations after a few years, where the organizations were again, let's say, without funding and without sources. So I think that was a very important moment for our social mobilization in Poland. Although in pandemic, even if we did not research this directly, there was also quite a strong mobilization for social support in Poland, in supporting other people who are suffering with the disease, this grassroots movements of neighborhoods and so on. But that's not from our research really, but from our experience, let's say, what I can just shortly comment. Thank you.
Thanks very much, Eva. And I think it's probably time for us to move over to Nadia, who's been patiently waiting with a separate reflection or question. Nadia.
Thank you, Christopher. Can you hear me well? Okay.
Yes, we can.
Oh, thank you. I lost the first two presentations, and I think I lost a lot. But anyway, I'll be trying to make some comments from the experience we had in our project. And it's great to have a continuity of the discussion from yesterday to today, because we had an access or care provision that comes from the small groups, from grassroots groups, in situations where the state fails, was a departure point. And then the comments come from the experience of mapping 1,000 of different campaigns. We could got information that took place in Brazil during the pandemics. And we tried to search different sources, all sources we had, and 4 comments. The first thing that called my attention is that the very idea of solidarity was an idea in dispute, depending on the departure point, the ideological, identitarian, as you prefer, departure point the group had. I mean, we had been following a national network named Live Periphery, which was quite close to the experience of the landless workers, rural workers in Brazil. And they were quite eager to underline the difference between solidarity and what they call solidarity and company, SA, referring to the campaigns that have been led by entrepreneurs, large bankers, owners, etc., and etc. The idea is that there can be real solidarity coming from bottom up, and this solidarity and company that comes top down. And that is my first point. If you found that the same thing in your field work, that the idea of solidarity could be a terrain of dispute among different actors. The second point is, in a certain extent, related to it. We began to work with the idea of solidarity chains since we realized that this horizontal experience of solidarity, collaboration between similar and grassroots groups that feel a common identity requires, or at least required, resources and a flux of resources. And we begin to follow the money, where the money came from, how it appeared there, because it was costly. And then it was interesting because we began to work with the idea of vertical chains and horizontal chains, and the intersection between these two types of chains to produce the result. And sometimes we realized that the grassroots, the local groups, had no experience of managing a lot of money, intermediation, the flux of money, all the resources, not only money. And some intermediaries appeared. So it was people that had and got the money, those who make viable the money circulation, and those who promote the campaigns. No? That's the second point. If you found something similar, no? Or if it makes sense for you from your field work, that idea of vertical and horizontal, we are not totally sure about this. It's risky, but we are trying to observe. And the third point, I love the point Dorota made. I'm sure, and Pamela, I think she referred this to, there is really a polycrisis in our poor and very unequal countries. So it's interesting that we can take pandemia in the situation of a polycrisis. And if you have this in mind, you can understand, for instance, in our case, what are the most important things that circulated during the pandemic? In our 1,000 cases, we realized that was food. I mean, it's hunger. It's not necessarily health, but it's hunger. No? And I think the point that Dorota made, it's quite important for us, or at least for the experience we got analyzing those campaigns. No? And we had to understand how it can survive post-pandemic. Because during pandemic, it was a result of the intersection, the group mobilization to resolve crisis. And the crisis continue after the sanitarian crisis. This is a very, very important reference for us. And in the Brazilian case, that's my last point, we realized that when we had this terrible, how can I say, I was going to say natural problem. It's not natural because against nature in the Rio Grande do Sul, the flood and almost disappearance of the city of Porto Alegre, we realized that some networks that were very active during the pandemic, they reappeared during the following crisis. Those are the points, but I love it. I love it, the continuity between yesterday and today. Thank you.
Thank you, Nadia. Anne-Emanuelle.
Yeah, thank you, Nadia, for those really insightful points and questions. I'm going to speak to a few, and then I'm going to actually ask Pamela again to jump in about Jardim Colombo's efforts. So the first question, this debate over language, what constitutes solidarity. We had the debate among us, or deliberation, around the term activism, which in the global north, scholar activism with community, it tends to have a more positive spin, if you will, in the sense of very closely working with community. In the case in particular of Sao Paulo, our colleague said, no, activists could be interpreted as outside agitators. So we entered into this long discussion, what would be the appropriate terminology? And we came up with engaged community members and engaged scholars working, in conjunction with community members. On the point of philanthropy or philanthrocapitalism, this is crucial again for the case of Brazil, and then or Sao Paulo, and the case of Montreal. So in the case of Sao Paulo, the G10, the G10 favelas, which is supposedly a solidarity group, but ended up as a completely self-interested, entrepreneurial. I mean, one of our colleagues is working on this right now in her doctorate. And for Montreal, the whole vaccine initiative in made marginalized immigrant communities was funded by the Trottier Family Foundation, which has a social good as its approach, and called it co-vivre. So this idea of co-working, And yet it proved very problematic in terms of trying to govern the direction of how vaccine campaign would take place, what to do about hesitancy, et cetera. So, and then just absolutely the question of food justice has played out in each of our projects. I'll speak quickly for Germany in the high-rise apartment buildings where many migrants live. It was the lift, the elevator, that served as a mechanism of working together, sharing food, sharing information, and so on, especially during lockdown. Among migrant agricultural workers in Ontario, ironically, hypocritically, these were food harvesters, planters, collectors who themselves faced precarious food situation. And in fact, a lot of the organizing, especially when they were under lockdown, mandatory quarantine in hotels, given a sack of this or that food, which may have not been culturally appropriate, et cetera, et cetera. So realizing food justice was absolutely central. And I turn to Pamela now to explain all of the food justice efforts, food sovereignty efforts in Jardim Colombo.
Hi again. Well, Jardim Colombo is part of Paraisópolis Complex, and G10, the organization that Anne-Emanuelle mentioned, is more active in Paraisópolis Complex. In Jardim Colombo, they have more church organizations, and it was the Residents Union plus the church who received donations and distributed already made food, and also food for people have at home, prepare at home. And they received from Itaú Bank, the bank Itaú, they received donation, and they received from the city mayor, but they said that it was so insufficient, the food that they received from the mayor. And they mobilized a lot of people who only have that time because of pandemic to be volunteers, but others were pre-organized. We have two people working from Paraisópolis working with us in this project, Camila and Vitória. And Camila was actively distributing food, organizing the residents, and making communication through WhatsApp groups. And she's in the post-pandemic now working, but she was already engaged. Other people trying to back to their old jobs. Many don't have, some have, we don't know. But during the pandemic, they mobilized a lot, and they were like, not from, it was a lot of solidarity, but in one of my interviews, I listened about being afraid of everything around lose control because people will be hungry and desperate and etc. So we have, it's of course solidarity, but plus there's more with this solidarity to mobilize people. And they had to deliver in the form of photographs and people receiving things. For Itaú, for example, there wasn't a report. It was more image, the image of donation, the image of solidarity. I don't know if I answer or something more that you want to know. I'm open to respond. Thank you.
Thank you, Pamela. Thomas.
Thank you. I'd like to address briefly the question of resources that Nadia raised as being quite significant in our research. One of the recommendations that we advanced through the interviews we conducted, and that has been endorsed through the co-creation process that we have launched in developing these recommendations moving forward, is the need for more flexible resources given to organizations, flexible in two dimensions. One, longer term funding agreements with municipal governments, with provincial governments with national governments, but also flexible use, so that permission does not need to be granted for every change in an expenditure line if a crisis requires shifting or reallocating resources in a particular way to meet the needs as they exist at that time. It's not a new idea from a management and budgeting perspective, but it's something that we found did not exist across the countries and the nonprofit organizations specifically that we included in our research. Providing that flexibility, providing that capacity allows the organizations to better manage the resources on the ground in some productive ways. Paradoxically, however, in thinking it through, in light of this conversation and other considerations, providing that flexibility also really diminishes the importance of partnering with other organizations. Right now in this environment, organizations that are restricted in use of funds, if they want to successfully address the crisis situation as it exists, they have to build relationships with others. But providing more flexibility in resource expenditure or resource allocation internally might reduce the need for that kind of partnership. And there's a cost to that kind of trade-off that we need to consider as we consider our governance adaptations.
Thanks a lot, Thomas. I'm conscious that a couple of our participants we haven't heard a huge amount from in this session. I haven't been in previous sessions, so I don't know how this that's been managed across the schedule for the whole day. But Sabina and Mihai, I don't know if you had anything particular that you wanted to add by way of reflection or questions.
Yeah, as I was listening, to the discussion, it occurred to me that the question we started the discussion with about, how the grassroots activities and organizations changed over the course of the pandemic and post-pandemic is probably a question that is relevant to all actors that were involved in the pandemic. And in our project, because of its nature, we perhaps had more engagement with elite actors and also through our partners. And my impression was throughout, actually, from early on in the project, that there was a sense of COVID fatigue. Very settling in very early on, combined with this poly-crisis that others have been mentioning already, that then distracted attention and resource to seemingly more pressing problems. And I'm just wondering whether you've had this experience as well, because for us it did generate not so much a problem in terms of data collection. People were still very willing to talk to us, and we had some issues, obviously, when talking with people who perceived us to be on the politically opposite side, as it's usual with these projects. But we could overcome that. But then when it came to actually trying to talk to our partners and other stakeholders to see how they might actually build on our insights to actually take the lessons forward and maybe start thinking about changing certain practices or procedures or guidance with the view of increasing the capability of reacting more efficiently then to a future health crisis or a different type of crisis. We encountered not so much resistance, but this sense of, okay, we have so much other things to do, that I do sometimes ask myself, are our findings actually being taken on board, and to what extent are they? Yeah, I mean, again and again we hear from our stakeholders this was all very useful. It's super to have such a long-term view because we were able to cover 3 years of the pandemic in our data. But at the same time, at least for now, I'm seeing very little evidence of actual changes that will be lasting. Yeah. So yeah, I just wonder whether that's only our problem, or because we are also dealing with media actors who are very much, pressed on time and pressed to engage with whatever is new, or whether it's a more kind of widespread problem.
Thank you, Sabina. I don't know if Mihai has a response to that or wanted to share his own reflections, but I hand over to you.
Yeah, thank you, Christopher. Yeah, so this was more of a reflection and also a broader comment or question. Yeah? So just to reply to the point by Sabina, I think it was less, let's say, COVID fatigue among politicians and other stakeholders as among authorities and funding programs for universities. I think, once the pandemic ended, there was less money around for projects about the pandemic. But otherwise, I think, there was wide appreciation or recognition of the fact that the pandemic had an impact. The question was more where and what kind of an impact. And this would be my question, or also to you, to the people that have done maybe more work with social media, on social media, and with surveys, so survey-based work as well. Whether you've seen some sort of let's say irreversible damage. I know that I'm dramatizing here a bit, but is there something particularly negative about the lasting impact of the pandemic, say on trust in institutions, in science in particular? Just as something that our team has come across. And so I saw that colleagues Emilia Palonen from Finland and Mateusz Karolak from Wrocław, and so Poland. So the people that have worked on our Twitter database were saying is that interestingly, also the people, in the Twitter channels we've analyzed, also the people critical of health policy were being critical while using sciencey arguments. So they were still arguing with the same statistics, maybe, so of the Eurostat statistics and so on. So there was a common ground. But I'm sure that there was also more contestation, for instance, in seeing. And the question is, was there such a longer lasting impact that you came across in your studies of social media, but also survey based research?
So I don't know whether we want to hold out the discussion on that question, which is, I suppose, quite a broad one until future sessions and meetings, because I think we are at time, and I'm sure everybody needs a bit of a break. But I just wanted to thank you for the opportunity to chair this meeting. I learned a huge amount, and it was very interesting to hear about your research, even though it's not sort of directly in the domain where I work. I learned a huge amount, and I hope that you're all collectively benefiting from the chance to speak to each other today and yesterday. So thank you. I think we'll wrap up the session unless Holly and or Minija had anything to add.
Yeah, no, I just want to say thank you so much. It was very, very insightful to follow the discussions. And thank you, Christopher, for chairing the roundtable.